Trans healthcare is vital and life-saving.
Trans healthcare is vital and life-saving.
Trans healthcare is vital and life-saving.
But there is a crisis in that system.
We wait too long to access a service which is pathologizing, inflexible and institutionally transphobic.
NHS England are writing their new specifications, which will govern how trans healthcare will work.
Their draft specification offers only minor reforms.
We don't need reforms.
We don't need reforms.
We don't need reforms.
We need revolution.
Informed consent.
Culturally competent practitioners.
A local, accessible service.
An end to gatekeeping.
Decent access to reproductive technologies.
An end to the white-centric, ableist and binary understandings of gender inherent in the system.
Provision of breast augmentation, facial feminization.
And voice surgery.
Trans-led democratic accountability.
A mental health support system that actually supports the mental health of trans people.
Fair access for all, regardless of citizenship or if you're incarcerated.
Modernized communication. Emails and phone calls, not letters that never arrive.
Trans people in charge of our own healthcare.
Trans people in charge of our own healthcare.
Trans people in charge of our own healthcare.
These are just a few of the things we desperately need but aren't on NHS England's agenda.
Trans people know what we need from our healthcare system.
And we will be responding to the NHS England's consultation.
But we won't confine ourselves to the narrow and leading questions set by the clinicians.
We will be writing, lobbying,
Picketing and protesting.
We won't confine ourselves to a healthcare system that doesn't value our lives.
We won't confine ourselves to a healthcare system that doesn't value our lives.
We won't confine ourselves to a healthcare system that doesn't value our lives.